All right, technology. Anyway, hi everyone, and thank you very much for inviting me to this presentation. My name is Sunita Teckchand, and I'm a clinical aromatherapist living in Dubai now for 25 years. My topic here today to share with you is aromatherapy and mental health. The reason I have chosen this topic is because it is very close to me, and I have worked a lot with mental health issues. This is my background. I'm not going to go into details. I have studied a lot, and I have emerged all these therapies that I have studied into one platform where I can help my clients, and I teach as well. So let's talk a little bit about mental health in ancient times. Now, the ancient Egyptian civilization, they seem to be the most forward actually in thinking of how to treat mental health. They encourage those affected to engage in recreational activities such as concerts and dancing and painting. So they were very proactive to help somebody in treating their mental health during that civilization. However, during the ancient Greek civilization, they absolutely, sorry, I'm unable to see my presentation. Sorry. So during the Greek civilization, there seemed to be a stigma attached to mental illness, and it was often shunned upon. People were locked up and on rare occasions put to death as well, which is quite sad. It was believed that mental illness was caused by a demonic possession like witchcraft or an angry god. Now, we all know about Hippocrates in the early 400 BC, the father of modern medicine. He first described social anxiety as shyness as early as 400 BC. Now, he had described many illnesses and their treatment in a scientific manner and written over 70 books. He believed and preached that as a healer or a doctor, one must make an attempt to help or at least do no harm. The term phobia, for fear or terror, was actually coined by the Greeks a long time ago. Now, this was how people were treated in old asylums, and I'm sure you've seen some horrific pictures, you see some old movies or something, and they were either submerged in a bath for hours, they were mummified and wrapped in a pack or sprayed with the deluge of extremely cold showers. In those days, asylums relied on mechanical restraints, using straitjackets, manacles, waistcoats, and leather wristlets for hours and sometimes for days. And of course, they were also given medication. In the 1980s, mental health was the third most expensive class of disorders, coming to approximately more than $20 billion in healthcare expenses. Anxiety evolved to keep us out of danger, to obey rules, and to treat each other with respect. Now, there are many types of disorders. We've got mood disorders, we've got depression, being bipolar, anxiety, depression, personality disorders, schizophrenia as well, eating disorders, which is so common nowadays, especially with the youngsters, PTSD, OCDs, and any substance abuse disorders as well. So what causes mental health disorders? Well, heredity, biology, psychological trauma, environmental stress, which is a lot nowadays, because if you live in front of a mobile phone mast or in front of factories, which emits all these gases and electromagnetic rays, it does affect our bodies and our mental health. Dysfunctional thoughts that lead to extreme emotions as well. And of course, we have COVID today, as you so rightly said, Dr. Amrita, earlier regarding how people have actually, during lockdown, have had major mental health issues. So for me, aromatherapy, or the use of the essence in essential oils, they are the life force or spirit of the plant. And as far as Dr. Carey also mentioned in the Mayan plants, it was very fascinating because it kind of reminded me like we are actually from the time before, medicines came into, or pharmaceutical industry came into the factor, we were using plant as medicine. So essential oils are the life force or spirit of the plant. Hence, it is safe to say that they have the power to revitalize and harmonize the mind, body, and spirit. Rose is known as the flower of romance and love. Fossils of roses have been discovered from 35 million years ago, also popularly known as God's work of art. That is so beautiful. Roses have powerful energy fields. They vibrate of electricity efficient. Molecules circulate via the bloodstream to address the targeted areas where they are most needed. Now, in my 25 years of working in aromatherapy, when I work with my clients or patients, I feel that if they have a kidney issue or they have a gallbladder issue, I actually choose essential oils that will help and stimulate that area, because the essential oils actually go into the blood-brain system and they attach itself to the blood vessel and work directly with the organ that you're trying to support and help. And there is a lot of scientific research proving this as well. Essential oils are extracted, as we all know, from trees, flowers, leaves, herbs, fruits, and grasses. Essential oils also enter the blood-brain system, as I mentioned earlier, through inhalation and absorption. So absorption is via the skin, or you can take a bath when the pores are opened up, and then you can actually receive a goodness of the essential oils into the blood-brain system via the skin. And of course, inhalation is through the olfactory system and into the lungs and into the blood-brain system. Now, when we inhale an essential oil, it's our limbic system that's working, which is our sense of smell. The limbic system, also known as the emotional seat of the brain. This is extremely vital as aroma and memories are deeply, deeply connected. Aromatherapy and our sense of smell. The hypothalamus regulates our emotional responses, and the thalamus stores our memory, like, for example, childhood. Maybe your grandma maybe came and gave you something when you were 25 or 30 years old, and it took you back to the time when you were 2 or 3 years old, and you remember that memory because it's stored in the hypothalamus. So in the thalamus, so that it evokes that memory when you smell something. Inhalation of essential oils not only give a message to the limbic area, but they diffuse into our blood barrier through the respiratory system, as I mentioned, when you take a bath. Now, I'm going to discuss a couple of emotional issues that people go through. And fear actually is one of the biggest emotions that humanity is going through, especially at the moment today. Now, one of my greatest teachers tells me that fear is false evidence appearing real. There is really no such thing as fear, but we as human beings, we are very fearful beings. And fear can cause the heart to race at a ridiculous speed. It causes sweats and sometimes temporary paralysis. Fear is something that is inborn from childhood. And when parents teach the children things like no, don't touch, there's an open flame there, do not touch. Well, then that's what they learn. No, don't do that, and so forth. So they learn the meaning of no, and then fear is developed from childhood. And this affects the kidney and the bladder energy. A lot of our emotions are related to our organs as well, as I think you would also know in traditional Chinese medicine. There are different emotions again, and anger is another emotion which is very, very common. And this can cause a heavy breathing, increased heart rate, shaking and trembling, a rush of blood to the neck and face, and so much increased blood pressure. It's like a volcano erupting, sweats and heart conditions. And this affects our liver and gallbladder energy. And I can tell you for a fact in my research that people who have had major anger issues, and I'm talking about rage, have had gallstones and had to have their gallbladder removed. Worry is another emotion that a lot of humans actually go through, a lot of worrying. This causes the body to go into overdrive and directly affect our relaxation levels by increasing the hormone cortisol. It affects our stomach and spleen energy. And this is what worry does to our organ. Now, grief and sadness as well causes a variety of different symptoms, from feeling extremely physical, feeling of heaviness in the chest area. It affects the lung and the large intestine. Now, also research has shown in aromatherapy and a lot of my learnings that I've had from my mentors that grief and sadness is also related to cancer. So a lot of my clients who suddenly had some kind of trauma or shock in their body, had an accident or lost their loved one suddenly, developed cancer pretty much right after a tragedy. Now, another emotion is we try to be somebody that we're not. So it can cause us to be someone that we're not, as we pretend to be happy on the outside, when actually we are down and sad on the inside. Like the clown face. And a lot of people live like that. They don't let people know their emotions. They don't share. They just keep it to themselves and they put on a happy smile. And this is going to affect the small intestine and the heart energy. Now, different emotions cause different changes in physiology. We know that the chemicals in essential oils have the power to alter the physiology of the mind. So for example, like lavender, which is the most common essential oil, is the first oil probably everybody buys, has a lot of esters in it. And they're very relaxing and they have the power to calm and relax anxiety. I'm not sure how many of you know that the chemical constituent of Lavandula augustifolia has also got alcohol in it. And so if you overuse lavender, so I ask a lot of when I give talks, that how many drops of lavender do you put in your pillow to go to sleep at night? A lot of them say 7 to 8 drops or even 12 drops. Well, if you put too much lavender on your pillow, it becomes a stimulant instead of a relaxant. But if you put 2 drops of lavender on your pillow, you'll sleep really nicely because it's the ester that is actually working and not the alcohol chemical constituent. Now, aliphatic aldehydes, which come in Melissa officinalis, in lemongrass, is very, very calming effect on the body, mind, and soul. Hence, understanding the chemistry of essential oils is a whole other subject. My own personal research of 25 years of working in this field, I have found that the floral medicinal plants are magical when it comes to treating any emotional condition. Flowers are depicted as the soul in various forms of art and poetry. They have a very subtle energy and heal the mind and emotions. Scent has the ability to revive memories that are associated with that emotion. As I mentioned earlier, the limbic system in the brain. So we have anxiety. And I'm going to give you a couple of case studies that I would like to share with you today. So this is a pair of female twins that came to see me with anxiety and panic attacks. They were diagnosed with severe anxiety. They were self-harming themselves, biting their nails to the brim and more. They were prescribed Prozac, Xanax, and Zoloft by a psychiatrist since they were 15 years old. The mother wanted to wean them off the meds and wanted to try aromatherapy and other alternative therapies to help with that. Now, to go a little bit more into this detail very quickly, I don't want to take too much of your time, is that these twins' father was a very strict man, and he would always shout at them and put them down, demean them. They were women, and he just didn't allow them to really come up in life when they wanted to study and go to university. The mother was the one that was really trying to help her twins, but the father was totally against it, and he would shout, and they would fight a lot in the house together with his wife. So I use essential oils of Rosa Damascena, neroli, which is aurantium, citrus aurantium. These are the flowers that come in the orange tree, Cape chamomile, which only comes from Cape Town, and Melissa Pure, which I mentioned earlier, which has aliphatic aldehydes, is very, very relaxing. The treatment method that was given to them was massage therapy. They would come very regularly. Again, remember, we're applying the oils blends into the skin, into the blood-brain system for it to work. We did not drink essential oils. because it will burn your stomach lining. And then they were given home blends as well, synergies that I had made to put in the bath, that many drops, and inhalers. Again, remember, inhalers go into the olfactory system, into the limbic system in the brain. And so it really helps to calm an anxiety or panic attack, which is just about to occur. However, after almost weaning them off, they crashed and went back to taking drugs. And I will discuss this a little bit further. Now, another client that I had of mine was with a very deep kind of depression. He was actually manic depressed, a 58-year-old male going through a tough divorce from the love of his life due to his possessiveness in undergoing terrible trauma, grief, sadness, and depression. He had it all. He refuses to take any happy pills, which are obviously Prozac and Zoloft, and he opted for natural therapies. He's actually an old client of mine, and he came as soon as he started having negative thoughts. He is a doctor by profession, so he knows the implications of taking drugs and that it would be difficult to wean off them. He is in total denial that his wife wants a divorce, and he cannot come to terms with that and that she's moved on to another person. Now, I used essential oils of sandalwood, patchouli, frankincense, and rose on him. I did inhalers. A lot of self-massage was given for him to use at home. So again, I believe in giving back the power to the clients and not have to them come to me all the time. So you make home blends. They massage it on the upper respiratory. Your nose is right here, so you smell it. It absorbs into the skin. So it's going through the olfactory and it's absorbing into the skin, into the blood barrier system with all these home blends. So a lot of inhalers and application were given to him. We also did a lot of regression sessions and other things that also helped him psychologically. And then my third case study was a man with panic attacks, very, very severe. 65-year-old male running a successful construction company. Suddenly he had massive panic attacks 3 to 4 times a day, which is quite debilitating. And they feel like a heart attack. He had full medical checkups and there was nothing wrong in his physical health, but it felt like a heart attack to him. These panic attacks came upon suddenly without warning. He does have a very stressful job as he creates a lot of new projects in the construction world and has tons of deadlines to fill and clients that push him to the brim. So I used a combination of different essential oils to treat him. One of the most successful being neroli, sandalwood in combination, together with jasmine, patchouli, and frankincense. The treatment was done massage as one of the main treatments very regularly, plus home blends were also given to him in inhalers and in the bath as well. So the outcome of the anxiety of the twins, since the girls crashed, I could do nothing more but advise them to start all over again. We were literally almost weaned them off all the medication. I had a one-to-one meeting with the father to encourage him to support the twins and not to shout and fight in front of them and keep his differences apart. However, he refused and said that it was none of my business and how he raises his family and left. So I saw the mother once more and she had no words to describe how she was feeling and looked hopeless and lost. I had to surrender, and sometimes you cannot win everyone. You have to let go. The outcome of the deep depression, after several sessions of aromatherapy, massage, counseling, and regression sessions, he finally turned around and decided he had to move on. He applied for a divorce to make things more legal. He found a companion who shared his interests and love of his hobbies. After the divorce was finalized, he felt an immense relief and started to enjoy traveling again, connecting back with his children and family members and basically leading a normal life. The panic attacks, after months of weekly sessions of aromatherapy, reflexology, regression, he became calmer and more relaxed. I taught him deep breathing exercises, visualizations, and meditation to help him more to have peace in his life. He hired more help and delegated his work to them so he could have more time to himself, which was a great improvement. His family too was very happy with the outcome and decided that using essential oils in their day-to-day lives was a blessing. These are some of the essential oils that I have used. I'm not really going to spend too much time over here because you can always Google these as well. Melissa officinalis is an aliphatic aldehyde. It's an essential oil for the psyche. It's one of the best oils that I love to use. It helps to fight depression. It acts as a sedative, so a person gets a really good night rest. It controls panic, balances emotions, calms the nerves, it calms the heart, and so many other things. So it's actually, you know, every essential oil that we teach, it has so many properties, physical uses, emotional qualities, that is quite phenomenal that one essential oil can do so much, even a single oil. This is a beautiful oil. I'm sure you've used it maybe in perfumes, Jasminum officinalis. It supports emotional coldness. It reduces emotional suffering, decreases mental depression. This is the main reason of using Jasminum officinalis. It also supports people with lack of confidence, which is obviously something that happens when a person is very depressed. It dispels fear, which is the core of our emotion. And it supports heartaches and, you know, losing loved ones and so forth. So it's a really great one to uplift the mood. This is my all-time favorite, Citrus aurantium neroli. This supports emotional exhaustion and it helps emotional wounds. It also supports fear, anxiety, depression, and so many other things. It's a really beautiful smelling oil. Again, let's not forget that to make perfume, because without essential oils, you cannot make a perfume. Rosa Damascena, this is a beautiful oil, a very expensive oil as well, like jasmine. It's very emotionally healing. It gives us a fresh start. It also gets rid of repressed anger. It supports grief and depression and addictions. So taking drugs to wean yourself off, I think rose is one of the best oils that can help with drug and withdrawal addictions. And violet leaf as well, Viola odorata, is a beautiful oil as well, which strengthens the heart. It comforts the soul. It assists with nervous exhaustion. It aids to clear past life issues. We do bring forth a lot of things from previous lifetimes, if you believe in that. It also acts as a sedative. It also stimulates pleasant dreams. So it's beautiful, overall joyful oil. This is my brand of essential oils that I sell here in the UAE. And I'm pretty much done. And I hope you've enjoyed this. And I'm open to receive any questions that you may have. I'm happy to answer them.